What is happening, everyone? Dr. Schott here with Balance Physical Therapy and Human Performance Center. So today we're gonna look at how to use a band to mobilize our hips. So a lot of times we'll have people come to us and say, I'm having issues with my hip, or I feel kind of a pinching pain or just general kind of restriction in their hip when they're doing something like a squat. So the first thing to do is that we want to test your squat. So what we can do is find a good open spot, and then just gonna squat down and then hold in your what you consider to be your bottom position. So for me right here, I'm being active, holding my knees out, holding this position, and I'm just feeling for what I feel in my hips. So for me right now, on the inside of my left hip, it just feels like kind of tight and almost a mild pinching sensation. And that's me. It's gonna be different for everyone. You might feel it on the outside of your hip. You might feel it in your knee. But the point is with this kind of first test is just feel, get down to that bottom position and just feel how your body feels in that squat, okay? So for me, the front of my left hip was feeling a little bit tight and pinched. And some of that can be because of my anatomy, and some of it can become a muscle restriction as well too. So what we can do is, we can use something like this, with these big, thick resistance bands to mobilize our hips like we do with our patients here in the clinic at Balance Physical Therapy. So what I want to do is take one of these bands, get it anchored to something really strong like this here. Could be a squat rack, could be a support beam, whatever. So what I'm going to do is I'm going to take this band and then I'm going to step into it here. So what I want is I want to have this band really up in my hip crease as much as I can, okay? So I'm going to step forward with my left leg in front, right leg back. I'm in this kind of split stance position. And then all I'm going to do is I'm going to slowly lean forward and touch my toes, but I'm going to feel that band pulling my left hip backward and a little bit laterally as well too. So bend forward. Feel that pull. You're gonna get a little bit of a hamstring stretch as well, especially for somebody like me who's a little bit tight. Slowly come back up. And then again, so right there, I felt like I could have used a little bit more of a pull, so I stepped a little bit away from my anchor point. And then again, lean forward, feel my hip pull back. So what we're doing here is we're actually causing a distracting force in our hip joint. What this does is it actually gets some of our muscle tissue in that area to relax a little bit. It also just increases joint space, gets more synovial fluid in the joint capsule itself as well. So again, lean forward, take up a little bit of that slack if you feel like you can handle it. Feel that distracting force going back in your hip. So we can do this anywhere, 5-10 times. Just feel it kind of loosen up your hip a little bit, and then retest. So I'm gonna go back in my squat position, get down into about the same range as I did before, and see how different it feels. For me now, I'm not getting quite as much as that hip impingement as I was getting before. So this is a simple way that we can mobilize our hips. Again, feel your own squat, identify where you're feeling your restrictions, and then we can use this band to get your hips warmed up. If you enjoyed this video, please check us out at Balance PT Move or go to our website at balancept.com.